Good day, students. I have created this concise lecture series as a practical guide to writing your case reports for your DM casebook. The objectives of this course are to help you choose and construct a case suitable for your DM casebook. At the end of the session, you'll be able to choose an appropriate topic and create an appropriate case outline for the chosen case, and then produce an acceptable case report, including introduction, case report, discussion, conclusions, and references, which will adhere to the DM casebook regulations. You should also be able to utilize the appropriate citation format and use relevant references, and overall identify an appropriate mix of 10 cases for your DM casebook. There are 3 short lectures. The first will focus on identifying an appropriate case and writing your introduction. The second will talk you through writing an outline for your case report, and then focusing on the case report section of the case. And finally, we will discuss the discussion, conclusion, and references. So what is an appropriate case for your DM casebook? Cases used should be topical and relevant to emergency medicine specifically. You should have sufficient information about the case to give the reader the information they require. This would include things like blood results, X-rays, ECGs, other scans. And as a minor point, you should be able to maintain the patient's confidentiality. If any of your cases need to be submitted to a journal, all journals now will require written consent from the patient, so it's worth keeping a track of the patient's name and contact details in case in future you want to submit your case to a journal. When you're thinking about what types of cases to write, they fall into 3 main categories. Topical cases usually discuss a common condition seen in the emergency department, but a topical area for discussion is identified, which you can discuss at length, giving up-to-date information and possibly focusing on a specific interesting aspect of the case. Controversial cases are cases in which there is an area of controversy about some aspect of the case that is worth discussing and that will be relevant. This controversy will be relevant to your audience in emergency medicine. And then finally, there are rare and unusual cases, something that isn't seen very often, but is important to the practice of emergency medicine and is worth discussing on an educational basis. So let's go through each of these. What is a topical case? Well, the topical case is probably the most common type of case you will write. You need to, it's usually based on some common presentation to the emergency department, in which you have identified something topical that is worth talking about. This may be new advances in treatment or diagnosis of the case, new thoughts about the pathology of the condition, new ideas about the way the condition might present, or changes in the disease's natural history. Whatever your focus, make sure that there is enough to talk about that will sustain your discussion. Bearing in mind that your entire case report is 12 to 15 pages, and of those, probably about a half of that is going to be a discussion. Make sure that the topic that you choose is really oriented towards emergency medicine. It should be of interest to the emergency medicine doctor, and very specifically, it should be of interest to your examiners. So think about that when you're choosing your topic. Controversial cases are cases in which your discussion is based on some current controversy with regard to the case that you've presented. And this may be controversies about treatment options. For example, what do we do with a patient with a submassive pulmonary embolism? Do we use thrombolysis? Should we proceed directly to embolectomy? Is simple anticoagulation and supportive care enough? This is quite a big controversy in the literature at present and would make a good controversial case to write. Maybe it's about diagnosis, things like scoring systems for upper GI bleed or appendicitis, in which there are several opposing and differing scoring systems. And a useful discussion would be pros and cons of these different scoring systems, and then your idea about what should be done. Sometimes it might be something more broad, like public health measures. Like right now we have this big controversy about the use of vaccination for COVID in the respect that a lot of the public does not have the confidence in the vaccine, and that is a controversy worth talking about. Maybe not particularly relevant to emergency medicine, but a good controversy to talk about. So again, both the case and the controversy should be important to emergency medicine, and as before, make sure that the controversy, there's enough about it written in the literature to sustain a discussion of up to 8 pages. In addition, you need to make sure that the controversy resonates with your audience, of course, including your examiners. It must be something that is relevant to them, that they want to learn about. The rare or unusual case has a place in your casebook. Again, even though it's a rare case, it doesn't merit inclusion simply because it's rare or unusual. It must be important to the emergency physician. So it's a rare case, but with a teaching point to it that is of relevance to a practicing emergency physician. I'll give them some examples here. Patients presenting with a hypertensive emergency secondary to something unusual and specific like pheochromocytoma. The use of emergency department thoracotomy. It's something we learn, we rarely ever see it. And if you've actually witnessed one, it's something worth writing. Other unusual presentations, such as, a patient with altered consciousness because of hydatid cyst of the brain. I've actually put these 3 because these are 3 things that I have seen in my career, which would have been relevant for any casebook, and specifically for the DM casebook. You would have had your own examples of rare and unusual cases that you might think are relevant to your DM casebook. So this one is slightly different in terms of how you develop it. The focus of discussion, rather than a specific area of the case, because it's a rare case, we take a more general view, and we present this more like a teaching case. So you go through a more standardized process of discussing the entire case, making it relevant to your audience. Remember, you still want to use up-to-date and relevant references. You're not writing a 30-year-old textbook. You're writing something now and up-to-date. As with all the other types of cases, the case needs to be relevant to emergency medicine audience, and especially for a rare case, you need to pull your examiners in. You need to tell them, I know this case is rare, I am discussing it because of X, Y, or Z, and make sure they buy into that. So, in terms of these 3 cases, how does your casebook balance off? How do these 3 cases distribute between the 10 cases that you have to write? This is just an idea, a suggestion of how they might balance. Most of your cases will be topical cases. So anywhere between 5 and 8 of your cases. You may want to put in 1 or 2 or possibly even 3 controversial cases if they are particularly relevant to the practice of emergency medicine. For your rare and unusual cases, I would suggest you stick to probably only 1 or 2 such cases. This represents a good balance of cases for your casebook. remember, there's another kind of balance to be had, which is you don't want to write an entire casebook only of pediatric cases. So make sure your cases represent the spectrum of what you've learned over the last 4 years, from adult medical emergencies through pediatrics, trauma, toxicology, even admin. Make sure you have a breadth of cases that represents the breadth of what you've seen and learned over the 4 years of your DM. Just briefly, let's talk about the introduction. So the purpose of the introduction is to introduce the case and topic. So you're going to tell them what the case is, why it is important to the emergency physician, its relevance to EM. You need to give a one-sentence justification of why you want to write about this, and then tell them what your focus of discussion is going to be. But remember, you're trying to draw them in and make them interested in your case. However, whatever you promise to do in the introduction, you must follow through in your discussion. The structure of the introduction is 100 to 500 words. That means usually no more than 2 paragraphs. And it needs to have a start where you tell us what the case is, a middle where you justify your choice, and an end where you tell us what your discussion is. And I've given you a little example of what your final sentence might look like. This case demonstrates the importance of early diagnosis of sepsis. The discussion will focus on the pros and cons of the Q-SOFA score in achieving this goal. So you're telling them, you round off your introduction by saying this is important, and this is what we are going to focus on in our case. If you have any questions, please feel free to contact me directly or post them on the WhatsApp group or bring them up in class on a Wednesday. In summary, this short lecture talked about how to choose an appropriate topic for your DM case report, how to produce an appropriate and acceptable case report, including the introduction, which is what we focused on in this lecture, and how to identify an appropriate mix of 10 cases for your DM casebook. Our second lecture will focus on how to write an outline and how to produce your case report. Thank you.